After a cancer diagnosis, patients have to adjust their priorities. They need to cope with reality, and at the same time, they need to act fast. In most cases, a patient will not receive adequate cancer care because they don't have the funds to start medical treatment, and they don't have someone who tells them what the next step in their journey to recovery is.
Because the doctors, yes, they will give our patients the diagnosis, but basically that's pretty much what they do. They say, well, you need to go make an appointment with the oncologist. Patients have no idea where they need to go.
Hace como 2 años tuve cáncer en mi seno, en la tiroides y en los ganglios. Uy, cuando me dijeron que tenía cáncer, de pronto dije, bueno, pues hasta aquí llegué. Entonces la doctora me hizo pensar que todavía hay muchos tratamientos y mucha forma de salir. Entonces yo dije, no, pues si no tengo dinero y para todo este tratamiento, pues ni para qué empezarlo.
By talking to other cancer patients, Josefina started to learn about some of the different programs available for people who have no medical insurance or are underinsured. Because she was searching for help by herself, she didn't get her care in a timely fashion. Time is a precious commodity a cancer patient doesn't have. After surgery, radiation, and chemotherapy, Josefina went into remission. In 2015, University Medical Center of El Paso started the Patient Navigator program, a program designated to guide patients through the complex cancer care system and ensure timely diagnosis and treatment.
A patient navigator is someone who helps a patient navigate the entire system from first diagnosis, or starting from abnormal mammogram really, to the process of getting the biopsy, being seen in the breast clinic, to then receiving treatment and getting access to all the services that are available.
Before that patient navigator, I really saw a lot of patients that were getting lost in the system.
A patient navigator is trained to guide the patient, assist in filling out insurance paperwork, identify local resources, and supports effective communication with their physicians. 2 years after Josefina was declared in remission, her cancer came back. This time, a patient navigator was there to guide her and tell her where to go and what programs were available to help her.
A lot of our patients that we get have no insurance. Once the patient navigator does their psychosocial assessment, she will be able to determine the needs of that particular patient. So basically, our goal is gonna be for the patients to start treatment. That's our main priority.
Rosa María me ha ayudado muchísimo, muchísimo a buscar descuento en el medicamento que es tan carísimo. Me indicó a qué oficina ir y con qué persona hablar. Y ella me sacó mis citas cuando yo no podía saber a quién dirigirme. Y ella me ha orientado y me ha ayudado muchísimo. Es muy, muy importante tener una persona como Rosa María.
The Patient Navigator for breast cancer patients is funded through a generous grant from the National Breast Cancer Foundation. In its first year, the Patient Navigator has helped over 130 patients to begin medical treatment for breast cancer.